The strategic direction, particularly the aspect around $7 billion by 2020, I'm often asked, how is that consistent with our mission? And on its face, it doesn't seem like it would be, right? I mean, you never heard the sisters talk about, we want to get to, 200,000 by, 1893, so it seems a little foreign. But the point of the matter is that if we're gonna, we love our ministry. We want it to continue beyond the 140 years that it's been in existence so far. The only way to do that in this current healthcare environment is to get bigger.
Our sisters always had challenges about how to use the resources they have. For example, not everyone knows that our sisters at one point operated railroad hospitals for railroad companies as a way to bring in revenue. They didn't do everything by walking around with a basket and collecting money. That wasn't feasible. They made decisions that there were certain operations they had to do to keep their mission and their ministry alive, and so do we. We have to operate in a very strong and efficient way and in a very creative and diverse way.
This new model of healthcare delivery where we're gonna be less hospital-centric, less procedure-based, more coordinated in our care, focusing on promotion of health, disease prevention, primary care, and try to keep people out of hospitals. It's a major shift from the way we've operated for the past probably 50 years when you look back over the history of medicine. What I like about this is I think this brings us back to the roots of what our ministry was all about when we started early on. While the sisters didn't have the techniques available to prevent disease, what they were ultimately trying to do is heal people. And they weren't necessarily waiting till people were in need of acute care services or hospital-centric services.
A personal experience I had that helped me to understand how we are changing the way we deliver care was actually in the context of pastoral care. My dad died about 2.5 years ago, and he was being treated at St. Mary's Health Center in St. Louis for his illness, and an illness that ultimately took his life. All that time that he was sick, about 5.5 months, he was in the hospital twice. He was in each time for complications of his cancer. Otherwise, he received his diagnosis in a physician's office. He received chemotherapy in an infusion center in one of our medical buildings. He received outpatient radiation oncology. He received home care and hospice care. And in every one of those stages, a chaplain saw him. So that's one example that brought it home to me. Obviously, clinically, my dad was being treated outside of the four walls of the hospital to a great degree, but he was also cared for pastorally in alliance with that clinical delivery of care.
We have the ability to do what's ultimately the goal of Catholic healthcare, and that's healing. And healing is an all-encompassing term. It's not just physical, but it's physical, psychosocial, and spiritual.